Hello, everyone. Thank you for joining the breakout room associated with Me Smile. Allow me to introduce myself again. My name is Ketki Bhatia. I represent the Digital Health for Development Hub from UNDP, and we work with a lot of country offices. Helping them, empowering them to digitize, SOPs or workflows in their respective countries. And there are two countries that I'm showcasing today, and I'm going to begin with Indonesia, wherein we have developed an application called Me Smile, which takes care of medical healthcare waste management. Me Smile is actually a part of what we call as a Smile platform, wherein Smile is a logistic management information system, and it handles the supply chain and logistic management of vaccines, essential commodities, rabies. It also takes care of commodities or and medicines associated with TB, HIV, and there's one more that I can't remember. But while we were building the logistic management information system for medicines and vaccines, we realized that we could expand the entire concept of logistic management to incorporate healthcare waste management as well. So, as all the learnings evolved from our technical endeavor of digitizing the public health space, especially in terms of supply chain for vaccines, we expanded the program to, first on a pilot basis to understand if we can do the same thing, logistic management and tracking for medical healthcare waste management. And that's how Me Smile was born. What you see on the screen is actually the entire workflow, wherein, there are applications that have been built by UNDP. There is a mobile interface and a web interface, but the mobile interface is the one that is widely used by the frontline healthcare workers to, track the dissemination of vaccines or even understand, if they need to place an order or accept an order or do, inventory management and things like that. And along the line, as we evolved, we did an offshoot and developed something what we called as Me Smile for medical healthcare waste management. And I chose medical healthcare waste management as a showcase, because in the space that we all are in, there are a lot of applications and there are a lot of work done around vaccine or essential drug commodities supply chain management. But there were very few when we were also doing our research and analysis. We could not, find lot of digitized applications that were helping the track and management of medical healthcare waste management. So some of the challenges that we saw when we started doing the study and the research analysis for digitizing the space was that there was in general a very poor visibility in terms of how the waste is treated once it is collected at the hospitals. There was poor waste segregation. Nobody knew how much waste was going to incinerator, how much waste was being handled by an autoclave, or for that matter, how much waste was even being handled to a third party, for the proper disposable mechanism. So some of these problems were quite big in nature and were also leading to a lot of economical inefficiencies and capacity inefficiencies. Um, Obviously, as I said, there were a lot of economical inefficiencies, but at the same time, because there was no track of the waste that has been generated, there was a lot of illegal dumping, which was eventually, leading to a lot of health and environmental hazard, because of the kind of waste that has been generated from all health facilities. So what exactly was done? So what was done was a application was developed which in real time monitors the entire life cycle of the waste. It is connected to IoT devices, and these IoT devices are connected to weighing scales. And you'll see in the subsequent video that I will present that it automatically connects to the Smile application, and there is absolutely no human entry required because of these IoT devices. And so the chances of error or the accuracy of reporting increases tremendously because of the application that has been developed. This particular document that I'm showcasing over here will be shared with the participants. The subsequent pages talk about the project design and some of the workflows that we did. But I'm going to segue from here and show you the actual application that was developed. Um, this is a long video, but I have paused it at the right, from where the actual application start. We'll watch 3 minutes of this video, and then we'll move on to another important point as well. So I'm just playing this. I hope you all will be able to hear this. I'm just confirming, is everyone able to hear the video?
We cannot hear the sound,
Okay.
but we can see slices of the
yes,
video.
exactly. Yeah, there are subtitles. So while I'm trying to figure out the video thing, I'll just you all can read the subtitles.
Can be displayed in real time. For hospitals with on-site waste treatment facilities, such as incinerators or autoclaves, MeSmile can record information on the produced residues before being managed further by the third parties. For healthcare facilities without on-site treatment facilities, third-party waste companies will pick up the waste daily. Sanitarians scans the QR labels and records the waste bags that will be collected on that day using the MeSmile app. Once all waste bags are ready to be transported, attendants scan the truck's license plate number. The MeSmile app automatically reads the numbers on the physically scanned license plate. This feature serves as a verifier tool to ensure no manipulations of the transporter, guaranteeing that the waste-carrying truck from the hospital is the same truck that will arrive at the third party's location. Afterward, the truck is ready for the third-party waste treatment facility. The hospital will receive a notification in the MeSmile app confirming that the waste has been handed over to the waste transporter. Once the truck arrives at the third-party waste treatment facility, the third-party operator will also confirm receipt through the MeSmile app. Third-party operator scan the truck's license plate number to verify and identify the waste bags carried by the truck for processing. After scanning the license plate number, the receiver performs a second verification by scanning the waste bags to ensure the truck's license plate number matches with the QR code on the bags or bins. If everything matches, the waste carried by the collector can be accepted by the third party and is ready for processing. MeSmile is capable of monitoring the end-to-end process of solid and residual medical waste management from healthcare facilities, third parties, to final disposal or landfill. As of April 2024, MeSmile has recorded over 563,000 transactions, totaling 4,200 tons of waste from 34 healthcare facilities. For the sustainability of the system, 843 sanitarians have been trained in operating MeSmile. This number is expected to increase along with the commitment of the Indonesian Ministry of Health and UNDP to expand the use of MeSmile to at least 1,000 hospitals by 2025. Cross-sectoral support and cooperations are crucial to prevent unsafe disposal of medical waste, which can cause environmental and public health risk. Additionally, waste that can still be processed.
Yeah, so this was about the Me Smile. But the journey for Me Smile has not been this easy. And it actually, when UNDP started working with the Indonesia Ministry of Health for the entire digitization endeavor of for the logistic management information system, there were a lot of steps that were done. And this program actually started somewhere around 2017, and now Smile is fully functional. Almost, I would say, 80% of healthcare facilities in Indonesia are on Smile. And the target that was mentioned over here for 1,000 facilities, we are working towards that. As we speak, more than 15 to 1,800 technicians have been trained on Me Smile as well. Now, from 38 hospitals over the course of, from when this video was made, we've gone to 50 plus hospitals. Over the last quarter, with the help from the digital hub, we were monitoring if the Me Smile as an application has the capacity to scale up to these 1,000 hospitals. And as we speak, we are tweaking a little bit of the architectural design of the Me Smile application so that it can be scalable. And we are all working very hard, to ensure that we can try and implement Me Smile and allow the access of Me Smile to the 1,000 plus hospitals that have been identified by Ministry of Health in this year. It is a daunting task, but because of the experience that we've had in the Smile application, we are quite confident that we'll be able to expand that. And incidentally, this application has been built by UNDP using complete open source technologies. And we have access to the entire source code, and we've even facilitated technology exchange with other countries so that they can start using it in their country. But as I mentioned, I want to highlight something, or I want to actually highlight on lot of the background work that goes while we are doing this. And that's where I'm going to deviate a little bit and talk about what's actually happening in Mauritius right now. Because even before you have a digital application in place, there is a lot of work that needs to be done. And I'm also joined by Vichitra, my colleague in this call, and she and I will jointly answer all your queries that you may have after this. Um, as part of this entire digital endeavor, even before we begin building, the digital technology, I'll just make this full screen. Yeah, there is a lot of work that goes behind it. You have to understand what is the current landscape of public health in a particular country. What are the capacity gaps that you need to fulfill. You need to hear voice from the field. You need to have a community engagement. You need to find out what is existing, in the current ecosystem, identify the gaps that need to take you, to your vision of having an entire digital ecosystem, for your SOPs. But these cannot be done till you don't have well documented policy and regulation. And there are times where, and this is something that UNDP has done, where we've realized that there are multiple versions of a particular SOP, that needs to be digitized. So one of the things that is done is, like, working with all the government stakeholders, getting together a lot of SMEs in one under one roof, and coming up with an architectural blueprint which will help us to digitize, the healthcare space. How is that done? So the first step that we do, and UNDP Mauritius has done that, and they've moved on to the next stage, is where they first understand where do we stand in terms of digital maturity. And there is a huge checklist. There is a, for the digital maturity assessment that we use. We've also taken some inputs from WHO when we were creating the UNDP digital maturity assessment. And this assessment is done, at all levels. It is done at the digital level. It is done at the human capacity level. It is done at the process level, and it is also done at an infrastructure level. Once that assessment is done, we know where the country stands in terms of its policies or digital ecosystem and things like that. And then the next thing that organically happens is you identify, you know, how do you want to go about with this digitization? And that is what we called, assisting the government or working with the MOH very closely in helping them come up with the digital health architecture and blueprint. So over here, we engage with a lot of experts, to try and understand what is the ecosystem in other countries or what are the best practices in other countries, and help Ministry of Health understand what is it that they need to do to achieve their digitization dreams. There are a couple of other steps as well, but I'll stop right here